Yes. And you bring up a point about trust, is that in the media is we as gynecologists have been painted in a certain way. And many of us that are doing the good work are constantly battling and trying to get our patients to put their trust in us again. And with us talking about this and letting people know that when you come to us, it's not a I know best and you must do, but it's a we are having a conversation. My role for you is to make sure that I take care of you properly. I give you all the different options, but rule out all the different issues too. So I'm not just focusing on one thing. I want to make sure you are well. I want to make sure you are well. You don't have cancer. You don't have a blood disorder. You don't have this.
Right.
And your treatment options based on your family history that you just presented to me, this will be a better option based on this genetic test that we just did for you, just taking care of you. We are here for you and your well-being. And your well-being is what you tell me it is. Some people, I have people who their fibroids, it's 9 month size pregnant, and they're like, hey, doctor,
Mm-hmm.
we're okay. This is okay. I just got a new faja that is fitting me real good, is pushing it in. I'm good with that. And all we can do is say, hey, if you're not having any issues with your kidney function, your bladder discomfort is not
Mm-hmm.
bothering you, here's an MRI. We can check on things every few months and see where you are.
Right.
We are here for you with your own decision of how you choose to take care of yourself. And that is true across the board with gynecologists, is that we truly are here to take care of our patients.
Absolutely. Absolutely. So, Dr. Ikedilo, please tell us what other resources that you suggest for those who want to know more about minimally invasive gynecologic surgery or all the other topics that we talked about today in terms of living your best life after midlife in all the different functions physically, mentally, emotionally, and in all the ways that connect us to perimenopause and beyond.
Yeah, so I do have a website. My website is www.thegynlounge.com. I'm also on social media platforms. I'm on Instagram, Facebook, on TikTok. The GYN Lounge is the handle. For Instagram is the GYN Lounge underscore official. You can find me on LinkedIn, but going to my website will be a really good place to get some information. It allows you to book appointments, get more educational information, and allows you to get to resources. Is I rely quite a lot on what is out there. So is that my website allows people to come to there and still access good information. It takes you to the websites for robotic surgery, for Hologic, where they talk about their MyoSure, their NovaSure endometrial ablation, their excessive procedure, their Sonata. All of these things is you getting more knowledge. So when you are in front of your doctor, you're able to know what your options are, at least have a place to start. So it's not all brand new information. Um, yeah, truly, my website, thegynlounge.com, has great information.
It sure does. It sure does. So, as we get ready to part, please leave us some parting words of wisdom.
Yes. Okay. Well, to my ladies out there, what I say is, this transition that we all have to and must go through is a natural process, but it's a process that even though natural, you don't have to do it alone. It's similar to childbirth, is we do not ask people to go through childbirth with no medical help or no help from an expert. Is the same thing with this transition. You don't have to go through it alone. We are here for you. Is truly you can come to us with your symptoms or even lack of symptoms, just to become more educated, to empower yourself to walk through this journey in a healthy way. So definitely reach out to your gynecologist, your medical provider. You can visit me at thegynlounge.com if you would like. But truly in this journey is knowledge is power, and you come into us. It's a, what am I trying to say? It's a, there goes,
Privilege, benefit.
yes,
Yeah, okay.
there
I don't
goes
want to put words. I was like, think I know what she's about to say, but I'm not trying to
collaboration.
put words in her mouth. Yes,
Collaboration.
yes,
So I am here for you, and
yeah,
definitely reach out at any time.
absolutely. And I thank you so much for just providing this information from a Black woman's perspective, because I think a lot of times we're just getting information from so many different places, and really being able to say that yes, this is a collaboration. You don't have to do this alone. This is a privilege to take care of you, and not every physician has that perspective in terms of interfacing with their clients. For some people, it is a job; it's about the dollar. But I part of this podcast is being able to interface and talk with other providers who feel the same way about health, wellness, and healing that I do. I love what I do, but I love what I do because I can see the results when people actually are looked at as individuals and they're able to be interfaced with on that level. And that brings me joy. So I thank you so much, Dr. Cadillo.
Thank
And
you.
until the next time.
All
Until the
right.
next time.